This show is dedicated to a subject which we really do not really like to talk about very much: bad breath. My guest today is Luke Thorley, who is a dentist. Luke, tell me, what got you involved in this area of, what should we say, health as opposed to just purely mouth?
Well, I was approached by a leading mouthwash company, CB12, and asked them about, firstly, I was asked about my opinions on a certain subject matter. And over time, this has evolved into become quite a nice synergistic relationship where, they will ask me to give my feedback on some research that they conduct about the public's perception of bad breath, oral health, and everything in between. The research that CB12 conducted was fascinating, really. I mean, up to 80% of people we found were saying that bad breath they feel it's more unattractive than, say, someone's personality or their sense of humour. And considering that is often the first thing that you notice about a person, when you say hello to someone or you greet them, and even going further now in the UK, most people greet with a kiss or a little cuddle to start with. People are getting a little bit more up close and personal than they might have used to in the past.
Yeah, is there any specific age group where this appears to be more psychologically important?
There's the specific age group is from after 25. So when people start to look at going into work, when they start thinking about job interviews, dating, progression, moving through life, and intimate times, husbands and wives. It's far-reaching, this research, but generally it's after people become adults and they start to do things of their own accords, and they start to pick up bad habits and do things that they wouldn't have done when their parents were looking after them, and that's when these things creep into become a problem. When you're out and about in public and you meet your friends or they introduce you to their friends, and as a dentist, it's difficult because you'll know yourself, the first thing you look at is the teeth, and no matter how you try and stop yourself from doing it, you do it straight away. And then the next thing is if you introduce them and they come over, and and I know that periodontal gum disease and tooth decay, it can give off a scent from someone, and if they've had loads of coffee or if they're a smoker, you can sense that. And as a dentist, over time, you start to pick up these things, and if they get, untreated, then that's when it starts being noticed by their friends and family, work colleagues, and that's really where we're trying to break down that stigma.
Yes. So if we look at what I would call causes, as you know, it is multifactorial.
Correct, yeah.
So if we say, first of all, let's look at the oral health of the situation. The reason I say that is that often there is to be quite personal, there's often a particular odour that comes out of what I would call poor dental health, especially gum health.
I completely agree. I mean, that's for me, that's a telltale sign. You can smell it, and I don't know if you feel the same thing. If a patient walks in the door of your surgery, you know straight away, and you can sometimes in severe cases, when it's got really advanced, you can smell it for some time afterwards. After it leave a sort of lingering smell that's trails them out of the waiting room and out of the practice, and a lot of the time the people aren't aware of it because it doesn't happen overnight. It doesn't happen. The smell isn't there one day and then it is there the next day. It happens over time, and like everything, if you gain weight, you don't gain weight straight away, so you don't notice it for some time afterwards. And it's the same I find with the malodor, that it takes a little bit of time for people to develop it and then for other people to notice it. And the last person to notice is normally the person that it's affecting.
Yes, I do agree, and also the fact is that if you have got your loved ones or friends, it's a classic thing where often they really don't want to mention it.
Yeah, we're too polite. As Brits, we're too polite. We won't rush into saying things that we think might cause offence very easily. In other parts of Europe, they would not even hesitate to say something, and be as blunt as they wanted off the cuff, and say things about their friends, relatives, loved ones. They will just tell them immediately. But Brits have a very funny way of, avoiding the conversation and doing everything they can not to make someone else feel, bad. And that's just the nature of British people. They're very polite.
Yes, and I remember myself often as a practitioner that I would often ask my nurse, what does my breath smell like? Because it's the last thing that you think that you could be, what should we say, a culprit in an area that you should be looking at preventing.
Yeah, I mean, for us, it's a little different. It's easy for us. Like, I agree. If you go for lunch, and let's say you go for a lunch with the rest of the practice, it's not normally a sandwich you're having. It's normally, you might go for some fish, or you might, there might be some onions in there, and you always go back to work and think, oh God, I'm going to have to, get some mouthwash in there and make sure that I don't, come across to the patients. I can't be telling them, you need, you've got halitosis, and actually it's me that's the problem and not them. It's a very difficult one. I agree. In the past, I've also said to my nurses, are we good to go? Is everything okay? But for us, it's okay to breathe on each other. But certainly in offices, it's not the norm.
That's right. I mean, it's this social environment.
Yeah.
But if we're looking at causes of bad breath, we have to consider it as a health issue.
I agree.
Because as far as I'm concerned, we're looking at a situation where, in effect, we shouldn't have bad breath.
Correct.
So could you, Luke, go over the various causative factors related to not only mouth health but general health as well?
First things first is staying well hydrated. You know yourself, and I know, and other dental professionals will all say that anything that causes the mouth to become more dry, alcohol, running, gym, anxiety, makes the imbalance in the mouth between the bacteria that will keep the mouth nice and stable and the ones that may cause the malodor. That's where the problem lies. And once you tip it in favor of the bad bacteria, then that's when we might get this malodor coming across. Then going further, if we start to look at diet, if we really make sure that we've got a high nutritionist diet, full of fiber, full of folic acid, making sure that, things like pineapple and broccoli, these things, these foods are very highly textured. And even if you don't brush your tongue in the morning and in the afternoon, the high fibrous surface texture of those fruits and vegetables actually have been shown to clean the tongue as they go down, and they can take those very fine microparticles of food off the tongue and then not leave any for the bacteria to feed off. And then, this is where the imbalance may not be caused.
And that's a very interesting fact, because in the past, we've had experts speaking on things such as the microbiome and looking at imbalances. But the issue of fiber has always tended to be more from the point of view of gut health, i.e. the prebiotic and probiotic effects. But the issue of having high fiber to literally disinfect, stroke, frictionally clean them out is something that really is a very, very interesting point, and never really struck me in all my time.
Yeah, I mean, the toothbrush is designed to be abrasive, and any food that you eat that is abrasive will have the same form of effect, and whether that be helping to clean in between the teeth or right along the gum level. If you're having foods that are a little bit abrasive, every little bit helps. But it's in the soft tissues, the tongue, where these food particles will sit, and especially where the bacteria is mainly causing the biggest problem. We're talking about a level that you can't see to the naked eye, but it's certainly there. We both know it's there, and the tongue has almost like fingers all the way along it, and it's the deep parts in between the fingers on the surface of the tongue is where this bacteria sits. And if it's being fed by food that's left to just sit there all day, of course it's going to have a detrimental effect on the way that we come across to another person.
Yes, so if we take a holistic viewpoint, especially looking at the tongue, it is one part of the mouth that we always inspect mainly for pathology such as mouth cancer and other sort of possibly rashes, and as we know that things like striations caused by stress and lichen planus all have an effect. But I suppose also if you have, say, for example, a deeply furrowed tongue, which again can be a nutritional deficiency, that this also could contribute to a doubling of the effects of having bad breath.
Yeah, that's just so true. I mean, the amount of times you look inside a patient's mouth and the tongue is the worst area, and the only reason for that is diet. I mean, there's very few other causes for it, and dehydration, poor diet, poor amounts of iron and zinc, and it's seen in fissure patterns on the tongue, and it's alarming in some cases.
Yes, I mean, I remember I say remember, we go back many years where the first thing that a medical practitioner would do would be to ask somebody to stick their tongue out to look at their general health.
Yeah.
Whereas, of course, now I think most modern trained medical practitioners really wouldn't know where to start.
I completely agree. Yeah, I mean, I don't think I've ever been to the doctor and he said, kind of look at the back of your tongue before. But certainly, we as dentists, we certainly try, make sure that that's the first thing that we look at. All the soft tissues, make sure they're right, and then move on to the teeth. And that's why we're trying to make sure that this bad breath and that the mouthwash that's implemented is done correctly.
Yeah, that's really fascinated again, because getting back to a point you made about dehydration, and there is no doubt that in a dry mouth, and of course, I suppose if you said somebody came in who had, say, a dry mouth, the first thing that we'd ask them would be possibly the levels of stress they're under.
Yeah, I agree.
Which would then lead to the fact that they could also be, because of that stress, they would be then looking at saying, well, is it because this is why I'm getting bad breath as well? So you're almost having a vicious circle.
Yeah, I agree, and that's why we're trying to get people to go to the website, cb12.co.uk. They can check out the research on there. They can also like our Facebook page and follow us on Instagram and check out all the details on there.